Our 7-week health campaign continues, and tonight we're focusing on infertility. This is National Infertility Week, the only federally recognized health observance for the infertility community. Women who are having trouble getting pregnant often seek comfort in talking with other women, but for men, infertility is often difficult to discuss. Tonight, a local urologist and a local attorney take action for all of us with an explanation of what can go wrong and how treatment can make it right.
But about 3 or 4 years into the marriage, we started really trying.
Gene Odom is a well-known trial lawyer in Tampa who is used to success in the courtroom. But he and his wife were having less success starting a family.
Following the calendar and doing the home diagnosis routine on what we need to do to try to get pregnant, and it wasn't happening.
Odom turned to urologist Howard Heidenberg for help. As a young man, Odom had testicular cancer, and he knew that that might be a factor.
We went through an extensive workup. He's got an amazing attitude, amazing positive attitude, because despite some of the indicators in that workup that it showed us that we might have difficulty finding sperm and difficulty in having success getting his wife pregnant, he kept his optimism.
Odom says his wife also had a medical issue that, once diagnosed by Dr. Sandy Goodman of the Reproductive Medicine Group, helped clear the way for a successful infertility treatment. Dr. Goodman and Dr. Heidenberg are married and have worked with many couples like the Odoms. With their case, they used a procedure where sperm is retrieved and married with an egg in a lab and then implanted in the woman's uterus. The Odoms got pregnant the first time with twins.
I could say we were lucky, but I think that would not be given enough credit to the doctors involved to understand the individual criteria, the diagnostic testing that was done to get us to that point.
Ethan and Maddie are now 3 years old, happy, healthy toddlers. Dr. Heidenberg says there are many different reasons why men may be a factor in infertility.
It can be congenital. People can be born that way. It can be acquired, whether that's through medication or disease. And unfortunately, a fair amount is idiopathic. We just simply don't know the reason.
The good news is there are treatments.
IVF is probably the most noted, and it's certainly the breakthrough story of our time. We're talking about men who have no sperm on their ejaculation at all, being able to actually surgically remove individual sperm, and through the skill of the Reproductive Medicine Group and their associates, actually fertilize eggs and bring children to bear.
Other options, he says, include concentrating the patient's sperm and inseminating a woman, adjusting medicine can sometimes cure the problem, or diagnosing an underlying illness like testes cancer, lymphoma, or hypothyroidism. That can be a good first start.
We never assign blame. As a loose statistic, if we were going to look at the numbers, about 40% of the cases there's female factor, about 40% there's male, and about 20% there's a combined factor. So it's a couples issue, it's not a blame issue, and the baby pictures, basically say it all.
Well, because of the cost of fertility treatments that can go into the tens of thousands of dollars, Gene Odom is setting up a foundation to raise money for and fund fertility treatments for those who cannot afford it. If you'd like more information on that foundation, go to my Facebook fan page. Just look for Linda Hurtado, WFTS, under Pages.